watching the presentation. So we're going to go ahead and get started now.
Okay, great. All right. So
I think you can the record button on your end at the bottom.
Yes, I just did.
Okay, perfect.
Okay, perfect. All right, so let's dive in. Let's talk about potty training first, and I'll have some pauses where I'll take questions, kind of as we go through this. So with potty training, you first have to think about whether your child is ready, and this is regardless of their ability level. There's just a few different considerations to think about. So one is, are they physically ready? So can they raise and lower their pants independently? Can they pick up full objects? Are they fully ambulatory? Can they sit independently? And maybe for your child, they'll never be physically ready, and that's okay. But then we need to think about workarounds for that. But generally, being physically ready is important. And then bladder readiness. So can they stay dry for several hours? Or are they still at the point where they're going, having a wet diaper every 15, 20 minutes? Maybe they're not ready yet. Language readiness is important. So are they using and understanding toileting words such as pee, poop, wet, dry? If your child doesn't have language, then again, we might need to think about some workarounds of using symbols or little picture cards, things like that. And then instructional readiness. So are they generally good about following directions, or are they really non-compliant? And if so, then maybe we need to work on that part of it first before we are asking them to embark on something that requires following basic directions over and over. All right. And then another aspect of readiness is is proprioceptive readiness. So that's the idea of understanding their body in space. So do they feel the urge to go? Do they recognize when they're feeling wet versus dry? And can they control this urge? And then finally, social emotional readiness. So sometimes kids are just really afraid of going to the potty for various reasons. And that might be something that we need to work on, or they might be pretty rigid and they get stuck in a routine, and then changing that is difficult for them. So those are all things that you want to consider first when you're thinking about potty training. Okay, move on. Okay. So special considerations for kids with developmental delays. In general, kids with developmental disabilities require more intensive teaching. So increased frequency of sits, like toileting sits, more frequent and salient rewards, maybe even a mild consequence for accidents, and we'll talk about that in a little bit. Maybe removing the diapers or pull-ups completely. This is kind of a big one because these days diapers have become, they're so advanced and they really take away any of that natural discomfort that kids feel when they have an accident. They're almost like a walking toilet. So sometimes just taking that away completely is the way to go. Increasing fluid intake. So when you are potty training, really piling on the water and the fluid so that their bladder is full and they have many opportunities to practice. And then finally, this idea of stimulus control. So right now, the diaper has been paired with emptying the bladder and feeling that relief. And we really want to change that and make it the toilet and the bathroom, and increase that idea of pairing. All right, so I might just take a pause there and see if there's any questions. Are there any, Diana, yet?
We don't have any questions yet.
Okay, perfect. All right. Okay, so when we think about doing this over the course of a weekend, so an intensive weekend method, there's 4 components that we want to think about. One is increasing the fluid intake that I mentioned before, so really piling on the fluids. Another is the scheduled toilet sits. So I might start with a recommendation of sitting every 30 minutes, have them sit for 5 minutes, and really keep them at all times kind of next to the toilet or next to the bathroom, in that general area. So avoiding outings. This is really the time to kind of buckle down and just be like by the bathroom. And then if your child has a success and they're able to successfully go in the toilet, then you might be able to increase the amount of time to 35 minutes. And then if they have another success, you might make it 40 minutes and increase like that. And then similarly, if they keep having accidents, then you would decrease the amount of time and do it more frequently. So hopefully that makes sense. And then this idea of positive reinforcement. So rewarding when they have successes. And you might start with just rewarding sitting. So giving a small treat or like a sticker for just sitting. And then if they have a success, kind of giving something a little bit more salient. And then also filling the potty area and the bathroom with unique books or toys that are specific to that activity. And what I mean by that is they should have access to, they should not have access to whatever you're giving them at other times. So if there's like a special Lego that your child likes to play with, they can only play with that while they're sitting on the toilet, and not at other times. Hopefully that makes sense. And then finally, this idea of overcorrection, which we're going to talk about right now. Okay. So, so overcorrection, it's sometimes called positive practice. It's the idea that, if your child has an accident, what do you do? And it's almost functioning as a mild punisher. So we're basically giving a mild consequence for having accidents. And the reason we do this is we really want the child to see a contrast between when they're having success and peeing or pooping in the potty and when they're having an accident, and to create that contrast. So the way it works is when they have an accident, let's say they have an accident in the living room, you would be like, oops, you had an accident, walk them over to the toilet and clean them up as you would as if they had gone potty in the toilet. And then you would take them back to the living room and then say, okay, you had an accident here. We're gonna practice going potty, have them sit on the potty for a minute, and then go through the pottying steps. So sitting for a minute, flushing, washing hands, then going back to the living room, and then saying again, oops, you had an accident here, we're gonna practice again. So you do that about 3 times. And the idea is it's this idea of rehearsal. So we really want them to get practice of like, okay, instead of having the accident, this is what I should have done instead. Are there any questions about that?
We have one question. If you remove diapers and they don't feel uncomfortable, what then?
Okay. Yeah. So you might remove the diaper and they have an accident and they're just fine with that. So I would say that that's a really good place to try this overcorrection of, having this mild consequence for what they do instead. And teaching them that, okay, instead of having the accident, this is what I should have done. Yeah. All right. Okay. So next we're going to talk about reward systems. A really nice reward system that we use quite often with kids working on toileting issues is something called the dot to dot. And the reason that it's so effective, I think, is because it involves multiple levels of reinforcement. So toileting is something that requires a lot of practice and there's many steps. So you want to kind of find a way to continue your child's motivation so that they don't run out of steam. So the way the dot to dot works is you come up with some kind of prize. Like, let's say on the screen I have a toy dinosaur, and then you draw it out in dots, and then you would make some of the dots slightly bigger than the others. So like every third dot you would make a little bit bigger. And when the child, let's say they either sit when they're asked to sit, or they have a success in the toilet, whatever you decide one connection should be, when they do that, you would connect one of the dots. Once they get to a big dot, it would be a slightly bigger prize. So coming up with a grab bag of little rewards. So you might take like 30 little slips of paper and write down different rewards, such as staying up 10 minutes later past the bedtime, picking out what the family's going to have for dinner, or even like small monetary rewards. So like 5 cents, 10 cents, having some surprise rewards, putting all those slips of paper into a basket. And then once they get to a big dot, they get to pick that. And then it's a slightly, slightly bigger level of reinforcement, a little bit more salient. And then finally, once they complete the whole dot to dot, they would get the big prize, like the toy dinosaur. So in this case, we have like 3 levels of reinforcement, and it's nice because it kind of keeps the child's motivation continuing throughout while you're toilet training. I would say to start off with, having the dot to dot take about a week, and then they get their big prize. So don't put too many dots on your dot to dot at first. All right. Okay, so one of the questions that we had come up was about nighttime wetting, and I do want to say that. More people joining. I do want to say that nighttime wetting, it's really a different beast than daytime wetting. So you might have a child who is completely potty trained during the day, but they're still struggling at night. And that's pretty common. Like usually for a few years after they achieve continence during the day, they still might be having accidents at night. So I wouldn't be too concerned about that. And even in typically developing kids by age 6, 1/4 of males, they're still having bedwetting accidents, and 15% of females are still having bedwetting accidents. And this is at age 6. But if you're at the point where you feel ready to kind of tackle bedwetting, one strategy that we recommend and have had a lot of success with is something called the urine alarm, or the wet stop. And the way it works is you have this alarm, basically, and it's connected to a sensor, and the sensor attaches to the child's underwear. And that sensor is able to sense urine. So as soon as your child is asleep and has an accident, as soon as the sensor senses the urine, the alarm will go off. It'll ring, or it'll buzz or vibrate. And then the child ideally will wake up, and then they will be asked to go to the bathroom and finish urinating if they haven't already, and then clean up, and then put new underwear on, put the sensor back on, and then go back to sleep. And as you do this, you'll find that the accident piece of it will become smaller and smaller, hopefully, and that they'll be able to catch the accident more quickly. So, they'll start urinating, and then the alarm will go off, and then they'll finish in the toilet. So hopefully that makes sense, right? So it'll just happen. It'll happen sooner and sooner, and then it'll get to the point where even when they're, feeling the urge to go, then they'll just go and then urinate in the toilet. And we've seen really good success with this. There's about a 65 to 75% success rate. Usually it will take a number of weeks to get success. And you would want to continue using it until you have about a month of uninterrupted dryness. So a month of dry nights, and then you could stop using the alarm. Any questions about the urine alarm or the dot to dot?
Yeah, so we have a few questions. What about intentional accidents out of defiance? Should the rehearsal be used then as well?
Yeah, can you just read that one more time?
Yeah, so what about intentional accidents out of defiance? Should the rehearsal routine be used then as well?
Mm-hmm. Yeah, I think that we would also want to put in some skills for addressing the defiance in general, not just at that time, but at all times. But yes, I think that the rehearsal, yes, because it would still be serving as a punishment. But we would want to really minimize the attention given to, if you decide to use overcorrection, really minimize the attention given to it, because we don't want the attention to reinforce that defiance.
Okay, the next question, daytime wetting of a 6-year-old, also night wetting. Could you use one of these devices during the day?
Say that again, sorry.
If a 6-year-old is having daytime and nighttime wetting, could this device be used during the day?
I'm not totally sure, but I think that it can be used during the day. But definitely the evidence has shown that it's useful at night. And I'm gonna also, Kim, I'm just gonna unmute you as well.
I'm gonna mute myself.
Oh, okay. Yeah, my supervisor, Kim Reynolds, is also on here. So if she wants to chime in, I'm just gonna let her as well because she's an expert in this.
I will speak to the degree you want me to, Priya. Did you want me to speak to the daytime wetting question?
Yeah. If you know that.
I do. So Priya mentioned very smartly that the daytime and the nighttime are very different processes biologically and in terms of attention. That makes a lot of sense to parents usually. And so typically we'll work on one at a time, and usually the daytime first. In the case of a 6-year-old or really any child who's still having daytime accidents, a urine alarm can be a really effective tool to use during the day. In fact, we sometimes have kids who will use them in school even, although that's more rare because of the attention it can bring from other kids. The main reason the urine alarm helps during the day is similar to why underwear would help, which is that the second a child has an accident, they get feedback right then that, oh, that was when my bladder was full and needed to go. And that's usually the step that is one of the hardest for kids to learn, is when their bladder's full, their nerves are feeling that, and it's sending some signal to their brain, but their brain hasn't yet learned to say, oh, that's that feeling, and what I need to do next is stop what I'm doing and go do this other boring routine in the bathroom. And so the urinal alarm can help cue them right in time to when that needs to happen. Priya, can I say one other adjunctive thing earlier, or maybe even ask you a question you could answer?
Yeah.
A really nice question earlier was about the intentional accidents, and if kids are being defiant and using rehearsal. And yeah, I agree with you that using that rehearsal could be a really nice thing then. Priya, do you have suggestions for the group about how to implement a practice like that? It's also a mild consequence, but without being shaming.
Mm-hmm, mm-hmm. Yeah, so, and that's a good point, right? We don't want, when we do overcorrection, we don't want it to come across as shaming. So really just keeping a neutral tone and saying something like, oops, I had an accident, we go pee in the potty, and then walking them over to the potty and then having them sit and then doing that over and over. But not using shaming words or with your facial expression or your tone. It's really important to just keep it neutral and keep it like, oh, it's okay, right? It's like you had an accident, it's okay. We're just gonna practice.
Thanks. So in essence, the consequence per se is really just that they are going to do this kind of boring practice 2 or 3 times. Not that they're going to need to feel badly about having an accident, even if it was defiant.
Exactly. Mm-hmm.
Right.
Exactly. Are there any other questions?
And this last question that I have is, on Monday, our ABA therapist recommended doing a data collection phase for 3 days, checking for wet diapers every 15 minutes to learn what his regular drinking, peeing schedule is. Is this something you use with your families? I would love added perspective on this step.
Yes, we are big fans of data collection and monitoring.
Mom, me too. I'm sitting right here. Okay, you.
Yes. So I am on board with that. And she's probably saying every 15 minutes to really get a play-by-play of what's happening. And like I mentioned, with kids with disabilities, the teaching needs to be more intensive. Everything is just more intensive. And that's probably why she's starting with, even every 15 minutes, kind of checking the diaper and getting data. All right. So let's move on. Okay. So another question that you all had before we started this was around tips for older children and in children who are unable to potty train, how to increase independence. So this issue, it's really something that needs to be tailored for the specific child, but in general, as a child gets older, increasing independence is a great thing because it engenders a sense of autonomy, it builds self-confidence. So I would recommend kind of going in that direction. Some ideas that I had were, one, helping them learn how to assist with cleanup. So whatever they can do regarding the cleanup, whether it's wiping or flushing, or even if it's not even cleanup, but if they're able to notify the parent, like, I need to go potty, whatever they can do, have the bathroom kind of routine laid out, and it might help to lay it out visually, and then whatever step that they can help with, given their functioning, would be great. Selecting clothing that is easy to take off and on. So, pants with elastic waistbands, things like that, where given their functioning again, like if they're able to do that, those are great steps in the right direction. I mentioned the bathroom routine. Visuals are always things that we recommend. And then, if they are having physical limitations, maybe having supports on the toilets, that's something that you can work with an occupational therapist with if you haven't already. Things like that can be helpful. So, and I'm happy, like if there's specific questions around that to talk about that now as well. People have those. All right, so we're gonna shift gears and move on to sleep. So are there any other questions about potty training?
I don't have any other ones in the chat box at this time.
Okay, great. All right, so with sleep. So children with developmental disabilities, they can face unique sleep challenges, and that's something that I want to start off with. So they can have a higher rate of sleep disruptions. Consolidation of sleep can be particularly challenging for these kids. So staying up late, waking up early, having more frequent night wakings. And some children, depending on their condition, may be biologically wired to need less sleep. So it's important to, depending on your child's condition, talking to their doctor about, what does sleep look like generally for kids who have Down syndrome or kids who have autism or CP. And then once you know that, then you know what you're working with. And then we can definitely try behavioral strategies as well to improve things. But know that, there might just be these inherent biological challenges that you're also up against. All right. So I'm going to go through a number of different behavioral interventions for sleep. And please stop me with questions along the way. So when thinking about sleep, one of the main things is consistent bedtime routines. And this is something that applies, to all kids of all ability level. So having a standard bed and rise time and having a simple bedtime routine preceding bedtime is something we would recommend for any child. It doesn't have to be super elaborate. I'm a big proponent of, short and sweet bedtime routines. It can be as simple as, they have their bath and then you read a few books, brush teeth, pajamas, and goodnight kiss, bed. So it doesn't have to take an hour. It can take, 15 minutes, but doing it in the same order every night. If you have a child who is crying out at night, not staying in their bed, one thing that you can try is something called extinction. And this is where you basically let your child kind of work it out on their own. So you would leave them in their crib or in their bed, and you would leave the room and let them put themselves to sleep. And they might cry, they might scream, they might yell. But the idea is that we're helping them learn how to put themselves to sleep and to self-soothe and go to sleep on their own. If they're leaving the room, we'll go into that in a little bit, but you might have to just walk them back. And you would do that in a very neutral way without giving much attention. We call it the robot return. So you would just walk them back to their room. If they leave their room again, you would walk them back. It could take 20 times, it could take 30 times, 40 times the first night, but you'll get to a point where it becomes so boring for them that they'll kind of give up, and then they'll get sleepy enough, and then they'll stay in their room. So that's the idea of extinction, that you're kind of just letting your child work it out. And it's hard, but you should see effects if done correctly in about 3 to 5 days. The next one is graduated extinction. So that's when you might still check on your child, but you would do it on a schedule. So the first night you might go in and check every 2 minutes until they fall asleep. So you would come, you would poke your head in and check on them, and then you would say, I'll be back, and then you would come back in 2 minutes. And then you would slowly increase the interval length of time between checks. So then the next night you might do it 5 minutes, and then 10 minutes, and so on and so forth. You could also do it in the same night. You could start with 2 minutes and then start increasing. So there's different ways to do it, but the general idea is that you would start with more frequent checks and then increase the time interval. I also do want to mention this idea of fading the parents out of the room. So for parents who are currently sleeping with their child in the same bed, and they're like, how do I get myself out of the room without my child losing it? One thing you could try is fading your presence out of the room. So the idea there is that you would go from sleeping in the bed with them to maybe sitting on the bed while they're sleeping. And then you would sit on the edge of the bed, like a little bit farther away from them the next night. And then the night after that, you might sit in a chair next to the bed. And then you would slowly kind of inch your way out of the room until you're at the point where you're, by the door, outside of the door, and then finally completely out of the room. And in general, with all of these, one thing I want to mention is consistency. So the key is consistency. You want to stick with a plan. If you're going to try extinction, for example, or graduated extinction, stick with it for 3 days, and then decide, right? Are we making some progress? If you just do it for a night or two, it just may be too soon. All right. So I also want to go. Oh, maybe I'll pause there and see if there's any questions before I go through the others.
Yeah, we have a few questions.
Okay.
The first one is, how would I use extinction if he sleeps in the same room as his brother? I stay in the room for up to 20 minutes waiting for him to sleep, because if I don't, he'll crawl into his brother's bed, wakes him up, and then there's crying.
Give it to me one more time.
Yeah. How would I use extinction if he sleeps in the same room as his brother? I stay in the room for up to 20 minutes, waiting for him to sleep, because if I don't, he'll crawl into his brother's bed and wake him up, and then there's crying.
Mm-hmm. Yeah, so I wonder, is there a way that while you're doing the sleep training, you can separate him from his brother? Do it have his brother be in a separate room. That's the first thing that comes to mind. Is that even possible? But that becomes tricky, right? When you don't want your other child to wake up. So I wonder if the fading the parent out of the room might be a good strategy in this case, rather than going for all-in extinction, or maybe even trying the graduated extinction. So something that's a little bit less upsetting for the child, given that there is the brother in the room, even though it will take longer.
Okay, the next question is, what about kids, mine is 3.5, who cannot self-regulate well enough and require co-sleeping to stay asleep, and during wake-ups need to have support similar to an infant, a bottle, rocking, etc.?
Okay, so what I got there is that they're co-sleeping, they need a lot of support, and is the question how to stop co-sleeping?
I think just the child isn't self-regulating well enough. So maybe helping them helping them to regulate so they don't need co-sleeping.
Mm-hmm. Yeah, I mean, even for an infant, extinction is effective. So, so any of these would work, even if they require, right? I mean, the whole idea behind these extinction techniques is teaching the child to soothe themselves and fall asleep on their own. So extinction would work as well.
Okay.
I mean, as long as the
And
supports that they're, sorry, as long as the supports that they're needing are just like the soothing and things like that, and not more like medical needs in the middle of the night.
Okay, the next question. 2-year-old makes everything a game. Robot walking, will wet the bed to get parent back into the room. Room is stripped to a minimum.
Say it again.
2-year-old makes everything a game. Robot walking included. Will wet the bed to get parent back into the room. The room is stripped to a minimum.
So is this regarding, sorry, is this regarding toileting?
It sounds like sleep and toileting are combined for this little guy. It's a combination, she says.
Okay. Diana, is there a way that I can also see the questions like written out? That might help.
Yeah, if you hover down below on the thing that says chat.
There we go. Okay.
Yeah.
Okay, perfect. That helps. Yeah, so I think this comes back to why is the 2-year-old doing these things? Like, what are they trying to accomplish? If they're, usually when I hear that they're trying to make it a game, it means that the parent might be giving them a little bit too much attention around this. So with the robot walking, I would really minimize the attention. And you know, if they're doing things like wetting the bed to get the parent back in the room, if you basically the idea is if you can't ignore the behaviors, unless they're getting to the point where they're being destructive or dangerous, if that makes sense. So so really thinking about, you know, what are they trying to accomplish? And a lot of times kids, they engage in these behaviors either because they're trying to get attention from the parents or they're trying to escape something that they don't want to do.
Great. So the last question that's on here is, what are your recommendations when it comes to accidents, peeing or pooping on the floor, used as an avoidance tactic at bedtime or nap time?
Yeah, so in this case, I would imagine that when they have this accident, then it serves as an escape, right? Avoidance for napping. So I would, again, keep the attention to a minimum, and I would still have them help clean up, but do it as quickly as possible, and then get them to go to sleep. So minimizing the amount of escape or the time of avoidance, and also minimizing attention.
Yeah,
Okay.
so there's one comment here that says it's hard to ignore the behavior and stay calm yourself when your child does these behaviors, like mentioned above.
Yes, and I will tell parents that if in the presence of the child you can't ignore the behavior, walking away, turning your back to the child can be very effective as well, leaving the room. So doing whatever you have to do to kind of remove yourself from the situation. Again, there's some behaviors you can't ignore. If they're destroying property, if they're hitting another sibling, those behaviors you can't ignore. But things like whining, crying, screaming, yelling, those are all behaviors that parents can ignore or should try. They're hard, but should try to ignore.
Yeah, she says that her child thinks cleanup is a fun game.
Yeah, so we have to think about, how do we not make it fun? How do we not make it a game, right? We want to make this a very boring thing. All right, so let's move on. Okay. So the next intervention I want to review for sleep is fated bedtime with a response cost. So this is helpful if you have a child who's going to bed at an inappropriate time, like midnight or 1 a.m. So what you would do is let's say your child is going to bed at midnight. That would, when you start, that would be the normal time that they're falling asleep. So you would set the bedtime at midnight, or you could even set it at 12:30, so 30 minutes later. And then you would slowly shift the bedtime back every night by 15 or 30 minutes. And let's say, the bedtime is at midnight and they're falling asleep at midnight. Then the next night you would shift it back to 11:30. And let's say at 11:30 they're not sleepy. So then you would do this idea of response cost. So you would take them out of their bed and you would have them engage in some boring task, like cleaning up toys or doing something just really boring. And then once they get sleepy, you would put them back in bed. And then let's say then you accomplished 11:30 and they're going to bed at 11:30. Then once you kind of have that set, then you would move the bedtime back even more to 11, and then try that. And if you find that, after like 20 minutes, your child is still not sleepy, pull them out of bed and then do the response cost. So have them engage in these boring activities until they get sleepy, and then put them back in bed. Let me know if you have questions about that. And then finally, I want to review this idea of scheduled waking. So this would be for a child who is spontaneously waking up in the middle of the night and needs to be soothed. So one thing you can do if this happens is, let's say your child has a tendency to wake up at 2 a.m. At 1:30 or 1:45, you would go into the room and you would gently wake up the child, not wait until they're fully awake, but arouse them slightly. And then you would kind of console them, soothe them back to sleep. And then you'll find that they'll sleep through their normal time that they generally wake up. And then you'll keep doing that. So you'll keep waking them up about 15 or 30 minutes before their normal night waking time. And you would rock them or soothe them back to sleep. And then you would slowly start fading out these scheduled awakenings. So you might go from doing it every night to, every other night, and then so on from there. Another great strategy for kids who are leaving the room after bedtime or calling out is to use something called the bedtime pass. And it's really simple, but it's quite effective. So you would just take a small note card and you would write on it bedtime pass. You would decorate it with your child, and it would say something like, you know, I can use this pass to, and have it be specific what they can use it for. So they can use it to get a drink of water, or they can use it to give mom and dad a kiss or a hug. And then they can use it for 5 minutes, and then they have to go back to their room. So it allows the child one excused departure from their bedroom, and then they use their bedtime pass for whatever the activity is, and then they go back to bed. And then once they've used the bedtime pass, then we'll implement extinction. So going back to ignoring the crying, ignoring the calling out. And if they're still leaving the room, then you do the robot return, where you just, without talking, walk them back to their room. One question that had come up was, how many hours of sleep does my child need? So I have this table here that shows, you know, depending on your child's age, how many hours of sleep is recommended. And, you know, kids need a lot of sleep. That's what it comes down to. So even school-age children between 5 and 10 years, they still need about 10 or 11 hours of sleep. So some parents might find that surprising. But you'll find that sleep is kind of the foundation for a lot of things. So once they're getting this amount of sleep, a lot of other behaviors might just naturally get better, like defiance and acting out and anger and things like that. So this is what I would aim for. A question had also come up about naps. And when are kids able to stop napping? Around 4, kids are generally starting to drop naps, and by age 5, the child's brain is able to consolidate sleep all at night. So at that point, they might be starting to drop naps or may not need naps anymore. But some signs that you should look for if your child is around that age or even younger is, are they regularly able to skip naps and not be exhausted or cranky afterwards? So you might find that at first it might be, you know, like a few times a week they're able to skip a nap and not be cranky, but then the next day they still need their nap or they're a mess. And then it becomes even more frequent that they're able to skip naps. That's usually how it goes. If you find that they're napping, but it's really hard for them to fall asleep at night, then you might try shortening the nap or seeing if they skip a nap and then they can go to bed at their normal time. We recommend, even if your child is not napping, to still have quiet time, about like an hour and a half, even for, like young school-age children. That can be really helpful. All right, should we go back to see questions?
Yeah, we have a couple in the chat box here.
Okay. Let me just. Okay, let's see. Are we on? My child goes to bed at 8:30 p.m., usually gets up around 5:36. Gets very sleepy around 9 or 10 and asks for a nap. He is almost 9. Part of it depends on your child's condition and specifically what disability they have. There are some conditions that just like Down syndrome or cerebral palsy that can cause a lot of physical fatigue. So naps might be something that they need. So I would check with their doctor to see kind of around that part of it. But yeah, I mean, they're getting a good amount of sleep at night. Yeah, and I think, you know, if you feel like they really, given their condition, they really don't need a nap at that time, try playing around with the bedtime, maybe making the bedtime a little bit earlier, or thinking about when they're waking up at 5:36, can they stay in their bed for a little bit longer? And if they can't, maybe they can get out of bed but still be engaged in like a quiet activity rather than running around or waking everyone up. Does scheduled waking work with night terrors? I believe it does. From when I was kind of just doing some prep for this presentation, I did find that it should work with night terrors as well. So if you know that the night terror generally occurs at a certain time, I would try this idea of scheduled wakening. Did we get all the questions, Diana, or am I missing any?
Those are all the ones that I saw as well. Unless people have other additional questions at this time.
Okay. So hopefully this provided a broad overview of some sleep and potty training strategies. If you feel like, you know, your child's situation is more complicated or you've tried some of these things and they haven't worked, then it might be time to work with a specialist. At OHSU, we have the Behavioral Pediatrics program where we work with families on these issues. So that's one option. And there may be other options closer to your house, depending on where you live. So that just may be something to think about, and to know that, you know, once you've kind of tried some of this basic stuff, if it's still not working, you're not alone. You just might need some tailored guidance for your child. So reach out to us or to someone else if you need more help.
Okay, there's a couple of other questions that came in. Do you recommend a sleep specialist?
Oh, for the I would probably start with your regular doctor. And I'm not sure the specifics of your child, what condition they have. So I would start with your regular doctor and then have that conversation, and they can probably tell you whether going to a sleep specialist is needed. Can you provide examples of good, independent, quiet activities if wake early and in place of nap? Yeah. So the things that come to mind are like coloring, reading books, puzzles, listening to music, like with headphones. So nothing groundbreaking, but anything that they can do to keep themselves safe, depending on their age, and that doesn't require a lot of parent support or supervision would be a recommendation. All right.
I think that's all the questions we have. And we're just about to the end. So do you have any other recommendations to put out there? Or if anybody has any additional questions, now's the time. Okay, I'm not seeing anything
Okay.
come in. We did record this, and so we'll make it available. We also had the request to send out the slides, so people can refer to those. So we can send that out to everyone who registered. Did you have anything else to add?
I don't think so. Oh, I see another question. Would iPad for quiet time be okay, or screen time not great? I think it depends on how much screen time they're getting at other times of the day. So that's one consideration. I mean, it's not terrible, but it just all depends. So if they're getting a ton of screen time at other times of the day, then I would say for quiet time, maybe try a different activity. But if that's the only way to keep them quiet and that's the only break that you get during the day, then yes, maybe an iPad or a Kindle or something like that is what you need right now. So I would say it depends. All right. Well, thank you so much, everyone, for joining in. I hope this was helpful. We'll share the recording. We'll share the slides. Yeah, I guess just you can reach out. I put the website for our program. It's on the slides. You can always reach out to us if you want to work with us or have more specific questions for your child. But yeah, thank you all for your questions and your attendance.
Great. Thank you so much for doing this. We've had a lot of people ask for this session and really appreciate you doing this so much.
Good. So, I'm glad. Thank you.
Yeah, thank you. Everyone have a great day.
Okay, bye-bye.
Bye.